Hi, uh, welcome everybody.
Yeah, thank you so much for coming on, everyone from far, far away, and Regina and Martijn and Rob and dear Russell from all parts of the world. And Leslie Nelson should be coming on soon.
Hopefully soon. Corinne Hendy was going to be on this panel, but is unable to join us at the moment. And Leslie Nelson from Vermont is going to come on in her place. And so we're here to talk about system change, open dialogue system change in the time of the COVID crisis. And I think the basic theme here is that, we've been trying for a long time. All of us came to open dialogue, or many of us came to open dialogue with the hope of changing the mental health care or the approach to responding to people in crisis. What sometimes is called mental health care. Some people have issues with that phrasing. We're always looking for the better or right phrasing. And but we're all always looking for better or the best ways to respond to people in crisis. It's an ongoing struggle. And a lot of the aspects of open dialogue that we've been trying to bring, I think we can say fairly represent very basic elemental lessons that we learn in the course of trying to respond to crisis as it arises. And here we are now. Well, there's been a lot of challenges, whether it's, oh, hi, Leslie.
Yay.
Great, yay. And there have been a lot of challenges. There's always challenges, changing systems, confronting it, established ways of doing things, established ways of thinking, established beliefs. And here we are at a time when things are different. Things are changing very rapidly, no matter however we might like it to be. Things are changing. So it's good at this time to reflect on how things have changed, how they are changing, how our efforts to change the systems in the past have come into our learning and our response now, and what I hate to use the word opportunity, but what are the possibilities and how we can learn to respond, and how can we keep the changes that we're finding now as we move into the future. One thing that occurs to me, Leslie, not to put you on the spot because you didn't know until an hour ago that you would be with us, and thank you for that. It occurs to me that you, right, Louise is reminding me we have not all introduced ourselves yet. So
I gotta get myself together here.
So I'd like to invite everybody on the panel to do a very quick introduction, just so we understand who you are. And then as the discussion unfolds, we will, of course, be bringing in more context for where we're coming from and how it is that we have come to know what we know or believe what we believe. So how about we start, I'm going to go alphabetically. We'll start with Regina, alphabetically.
Oh, thank you. Regina Bisikiewicz, Poland. I am facilitator of system change. Actually, I am working for a very big project, which is dedicated to building islands of good practices. And the open dialogue is the heart of this islands of good practices. I will explain it later.
Thank you, Regina.
Thank you.
I love that, islands of good practice.
And I will add that we have met first time with Luisa 2011 in Helsinki.
Lucky me.
And according to the alphabet, Rob Coates.
Hi, everyone. I'm so grateful to be on this panel. I am a psychiatrist in Atlanta, Georgia, and I work at a hospital called Grady. And Grady is a system for people who are either uninsured or underinsured. And I've been, as Regina mentioned, working on islands of good practice in our system in the context of a team for people who experience psychosis or other extreme states for the first time, or in another program that's more sort of specifically focused around open dialogue.
Thank you,
Thank
dear
you.
Rob. Thank you for your good work.
Martijn? You are muted.
Okay, thank you for having me. I'm Martijn Kole and I'm from the Netherlands. I am a peer-support open dialogue practitioner and project leader, and most of all I am dealing with a lot of lived experience, and I try to use that for system change, but also for creating open spaces within dialogue and for peer support, a strong peer support movement.
Love that open spaces. Yes. Resonates.
And
Thank you,
thank you.
Martijn.
Leslie?
Hi, I'm really happy to be here and thank you for the invitation. And some of you are familiar faces and some of you may not be. I came into this work and met some of you folks through my work at New York City Parachute Project, where we got to learn about a lot of these ideas and we got to implement them on the ground fairly quickly, which I think was a very, very unique and important opportunity. I've since relocated to northern Vermont, where I have the great pleasure of working with others at the Howard Center, where we are doing a lot of implementation, planning, and training of work with these ideas and ways of being. So it's a great thrill to be here, and I am first and foremost a person with experience of this thing we called psychosis. And so I'd like to recognize that and acknowledge all my peers, as controversial as that word has become, that may be listening, watching, or on this panel. Thank you.
Controversial as it has become, I'm really curious about seeing if we can pick that thread up later, maybe. Thank you.
And Russell?
Yeah, hi, I'm Russell Razzaque. I'm a psychiatrist based in London, in England, also an open dialogue practitioner and trainer, also mindfulness trainer. And I've kind of been involved over the last, I can't remember how many years now, in setting up the Odessi trial, which is sort of a large multi-center trial in open dialogue going on in the UK across 7 different sites. And we unfortunately had to pause because of COVID, but we haven't stopped. We're still continuing. We've recruited a good number of people into the study, and we're slowly resuming now. So all okay, but yeah, that's what I tend to be consumed by most of the time. Yeah, the sun is out here in England, so that's also, even though you can't tell, I don't know why it looks dark here on my screen, but it's actually quite sunny, which is good news. Anyway, great to be here. Lovely to see you.
Thank you, Russell. I like that paused but not stopped. That's a global phenomenon as well. Yeah. Introducing myself, I just wanted to say that I'm a family member. One of my beloved sons became psychotic and we went on a big journey with him. And my purpose coming out of that was to change the standard of care so that people, instead of diagnosing and drugging, had the access to this kind of work that we're all doing. And I'm a dialogical practitioner as well, and a mindfulness practitioner. Very happy to be in Russell's training at this, not right, we would be almost there now. It's just wonderful, the pod training. Thank you.
And I'll say very quickly, my name's Herman Cole. Louisa and I were part of starting Mad in America with Bob Whitaker. I served as the first editor for a number of years, and now I'm continue to be involved in various ways. And I grew up in a family where I was hearing a lot of diagnostic terms being used. Never quite believed that they were accurate in describing what was happening, and I certainly could see that the outcomes of using them were not encouraging. And in adult life, after another career, I couldn't help but go back to school and basically try to learn and understand what I had seen, and I wanted to know if there were better ways to deal with the things I had seen, and that led me through working with trauma and psychosis, ultimately to training as an open dialogue practitioner with Louisa, and we work as a team. And here we are. And what's on my mind to ask? I'd like to ask Leslie. I know this is putting you on the spot, given that you were didn't wake up knowing you were going to be with us.
Tolerating uncertainty as ever.
Yeah,
Yep.
in the spirit.
Mhm.
But we have known you for a long time, and I know you're up for any challenge. And what I'm aware of course, you were in New York. You were involved in Parachute, correct? Yeah, I know that, and which was one of the earliest and largest open dialogue efforts in the United States. And from there you went to Vermont. And what's interesting about Vermont is basically a number of years ago, I think, was it somewhere around 2002, I guess, maybe more recently, the state hospital was literally washed away by a storm. And Vermont was left with the opportunity, again, to rethink how it was responding. So you have perhaps some of the most intimate knowledge preceding this crisis for what can happen when all of the fundamentals have been washed away from beneath you. Would you like to take that on?
When all the fundamentals are washed out from beneath you, isn't that the perfect metaphorical language for a lot of what we're talking about? Becoming disoriented, losing your footing, not knowing when you'll be grounded again. I wanted to add a little something into the Parachute narrative, in that there was this little thing called Superstorm Sandy that washed through the East Coast right as Parachute was attempting to launch. So there's also that theme, and so the project was stalled to accommodate and recover somewhat from all the physical damage that had occurred from that storm in the New York City area. So maybe I'm a storm chaser. I don't know. I think, and I would welcome, I don't want to get this wrong because I think the narrative on history is very important, but I believe it was 2011 with Storm Irene that caused so much damage to the state hospital that the decision was made to not reopen it. And I would like to name drop that I believe it was Dr. Sandy Steingart who forwarded the idea, or I believe the state of Vermont had really made a commitment to finding ways to work with people in the community as opposed to rebuilding hospitals and institutions. And at that point, others came forward with ideas of what could be done differently, and Dr. Steingart was one of those individuals. And to my knowledge, that is the true origin of the team that I supervise today, which I didn't mention in my introduction, is called the START team, and that stands for Stabilization, Treatment, and Recovery Team. And this indeed was conceptualized and thought of as an opportunity to provide very open dialogue-like specific services in the community as a way to respond to crisis. And it did indeed start doing that work and was funded to do that work. Over time, things change with funding priorities, as we all know, and funding processes. I'm so happy to say now that regardless of the inception and history of the team, that now we are a complete 110% community recovery peer specialist support team. And that's what we do, is provide peer support in the community of mostly Chittenden County in Vermont. So it's still a tremendous thrill to be involved in this work. I don't do as much in meetings work, but I do have, or direct care work, but it's a tremendous opportunity to teach and mentor and expand sort of the peer workforce here in Vermont, which is surprisingly not that large. And with that, I'm tremendously fortunate to be able to work directly with Dr. Steingart, we have partnered on numerous networks, and we have worked together, which has been just a phenomenal experience. And I see somebody that we know is piping in with some comments, and so I want to get in a shout out that the Department of Mental Health here in Vermont is very supportive of this way of working, and we hope that they continue to be very supportive, so I'll always put a pitch out for that. Mm-hmm. So I am also a trainer at the Howard Center in what has been called the collaborative network approach, and that's something that Vermont has developed, and much before I arrived. So I seem to make habit of walking in once a lot of the hard developmental and implementation work has already been done, and I just get to walk in and enjoy the efforts. So that's kind of my story, adding more and more and more to what you actually asked, but hopefully that's of interest to some of you.
Mm-hmm. Thank you. That very generous response. I wonder if any of you dear panelists want to pick up that generous offering.
Well, I can't tolerate the silence. I did just want to make comment that being on the spot, that's kind of where I live. So in that way, this is a theme that has erupted as a result of this pandemic and this global crisis, is that for many among us, that may indeed be our daily living point, and are there conversations to be had about that, and ways for us to share our knowledge and our experience with tolerating crisis throughout our lives.
I would like to continue and tell you my story. My story, journey or adventure in the mental health started 2005 when member of my family was diagnosed by mental illness. And that time I have no clue, no idea what mental illness is. I was completely in another world, let's say. But after a few years, when we realized in our family that in my country there is a asylum-based system, that there are big hospitals, that there is absolutely no hope for recovery, we decided as a family look for solutions, other possibilities. And then 2011, meeting HOPEnDialogue, meeting Jako Seikula, meeting all these fantastic people. Then we have met Luisa at the time. And for me, it was like a completely new world, as if I was in another century. So when I came back home, my heart was beating with emotions, and soon decision was taken to transfer, to implement HOPEnDialogue, to transfer from from Finland to Poland. I didn't know what I am saying, really, because it is completely different to do any system change in business area where I was working for international company than to do system change in social area, especially in mental health. But you know, when person does not know that it's not possible, the person goes forward. And it was that with me. And as member of family, as a parent, any barrier was not too big. And very soon we have met other people, other family members we have met professionals who were looking for new solutions, new possibilities. And then after 3 years, there were a really big team. It was a really big team. And we traveled around Europe. We have organized courses. And then it's important that having 300 people trained in Open Dialogue, we saw that it's not enough to have a training, because the system was completely closed, and the main system didn't want us completely, even rejected. So then we were traveling even more and met Trieste. And Trieste in Italy gave us really new possibilities, because Open Dialogue was hard for the complete solution, which we have met in Trieste. So prophylaxis, integrated treatment, and integrated social support, together with peers and Open Dialogue, it was a solution which we have described and put to decision makers as in the government as the solution you would like to implement. So then European funds were dedicated, quite big money. And now we are in the middle of the project. I am in this project a facilitator of the system change. And really, I am amazed how many people appeared and joined us, and how many enthusiasm we have found within our society. Peer support, families, professionals, social support. So now we are really facing new phase in the development of complete solution. And somebody wrote on the chat that maybe soon these islands will form ocean of good practices. So we are on the way to that. Thank you.
So some of what you said resonated there, Regina. Nice to see you again. It's been a while since we've actually met, hasn't it? I guess what resonates particularly is that what we have found over the last few years is that training people to work dialogically is not the hard bit. The hard bit is changing the system to work dialogically. Because prior to Open Dialogue, I'd been very interested in mindfulness, in acceptance and commitment therapy, and other sort of more relational ways of working. But the problem was that unless you change the system you're practicing that in, it's like swimming against a tsunami, right? It really, the impact is very, very limited. And this is what attracted me to Open Dialogue, because it's a system change as well. And so trying to make the trial work across multiple sites and towns and cities across the UK, the hard bit has never been training the clinicians, training the people on the ground to work and be present dialogically. As Martijn will know, and as Louisa will know, and anyone who's been on our course, you're working with willing participants, with people who are able and willing to do that and can make that journey. But it's the system change that is always the hard bit, trying to organize the service where continuity of care, where, sort of being able to form lifelong relationships with people is at the center of that. That's what's really difficult. And I mean, just before this call, I'm involved in some of the COVID response management and trying to push for maintaining that within our systems, because we expect a surge, within mental health services too. And how we can try and use this as an opportunity to make our services more relational, to try to reduce some of the impact. And even within the context of that, it's very hard to get these points across, because people still think in terms of commodities almost, and that's just how health systems work, whatever the field. And they think about this team and then this team and this problem and this problem. And so it's not easy to get this sort of seamless connectivity going on. So that has always been the challenge. And I think it always will be a challenge for it. And I suppose all we can do is to hopefully get some knockout results and show people that, what the difference it makes is not small, it's not peripheral, it's profound and transformative. And we have lots of anecdotes, we have lots of papers and information from Finland and from Tonio. What we need is to be able to show it on a mass scale, nationwide, in lots of different demographics, and and scenarios, and hopefully that will then make the argument, which we hope to do. We were well on the way, I believe, in doing that. To recently, I believe we can once all of this is behind us. But it is really about convincing people about the importance of putting in that energy to change the system, which is probably the most difficult and the most important part of it, I think. So I certainly resonate with you on that, Regina.
Russell, in a way, there's a question from Barbara Schaefer in the chat room, and in a way you've already addressed this, but I'd like to give you an opportunity to address Barbara's question a little more specifically, if you wish to. That she says she has experienced that increased care in the community has meant an increase of community treatment orders, i.e. forced medication. Can you say something about that and how to tackle that problem? And
yeah, I mean,
if I may say, I just want to say to anybody who's not actually in the chat room but is watching, we are taking questions in the chat room. Raffaella Pocobella of the HOPEnDialogue project, with whom we are collaborating to present this, along with with Open Excellence, what used to be called the Foundation, the Foundation for Excellence in Mental Health Care. Raffaella is taking people's questions and chatting in the chat room, and I just wanted to draw people's attention to that. So thank you, Raffaella. Thank you, Russell.
Yeah, sure. I mean, community treatment orders are relatively new in the UK. It's a decade or so ago they were introduced, but generally use of legislation and legal restrictions has been around, for as long as anywhere else. And I kind of see that as that's a symptom of the failure of the system, right? It's only ever used when the system has failed somebody, and so it's the way to bring all of those things down is to try to form relationships from early on. And as I said, that brings us back really to the systemic problem with the way that our services, certainly in the UK, are delivered. I mean, I know this problem exists elsewhere, but in the UK, in terms of not seeing the relationship at the centre of the care, really is what leads to these things happening, right? People in the UK, if you go from one team, and if you need more input, you then go to another team, and then if you go to hospital, you go to another team, and you don't know, and they're all new to you. Right, and in our crisis teams, you might see a new person every day. So all of these things are what leads to things spiraling out. So our system is very badly designed. And interestingly, the reason why we have some purchase now in the UK is because some of the people who designed that system are themselves looking now to change it, because they realise, quite honestly, that it's done some harm in the end. And that's why we've got some buy-in to making the change. But equally important is, of course, the understanding of the importance of that embodied connection in the work we do. And if you can create the context in the system, then that can come about. But the system change is just as important. Yeah.
Martijn, I see you agreeing. Would you like to speak to that?
Yes, and I'm also a bit troubled. Troubled in the sense that what makes the system change, or can the system that is changed open dialogues? What I experience is that a lot has to do with the inability to face uncertainty and openness. And the system is a sort of projection of that inability to deal with life, deal with sorrow, with pain, with not being average, of having more voices than the majority, the dominant voice. And what I see in practice is that professionals, networks, and everyone who is involved struggle with this topic, with this issue. And so next to system change, I think it is important that we support each other in creating that openness, that dialogue, and in my opinion, in its core is the stories about the pain that is sometimes inexpressible, that is sometimes troubling also the network, troubling everyone because we can't solve it. And so at its core, I think two things are important, that pain is not, and that struggle is not something from alienated second-rate citizens who are strange, but just human beings who are experiencing things in their life, and that we can try to share that experience. And the second thing is that I think that is important is dealing with vulnerability as part of life. And so I think it is not just a system change, it is also about a social change, about that we have to reevaluate our current ideas about what human life is and how we want to deal with loss, pain, sorrow, the things we can't solve, or maybe we have to face. So next to system change, I think it is also about a sort of learning how to deal with those issues as a society. And with that, I think there is one very important thing, in my opinion, is that the person of concern, that is most of the time the user or the patient or the peer, can have an inconvenient story, can have a story that is difficult to create openness for. So I think it is very important that my point of orientation is trying to open that story up and learn from that story. And make it, and find common meaning together, find meaning.
I just wanted to quickly say, Martijn, that you're absolutely right, and it's so important to remember that the underlying reason for the system as it is, or the difficulty in system change, is the resistance to ourselves, to all the difficulties within ourselves. You're right, and I just wanted to mention that I feel like this is something we're all being forced to really face now. So if there's ever been difficulty in facing anxiety, uncertainty, emotional turmoil, this is the time as a species. So it feels like we're kind of being forced to and required to face that. But that's absolutely right. Behind the difficulties in system change is the real underlying difficulty, which is us as a species, the difficulty we have in really being present with what's happening for us.
There's a question from Sam Plover, who's been a very active participant from the very beginning of these town halls. The question is about first episode, quote, first episode. He says, I have issue with that, as it seems some system once again set a measure of what is normal. And it occurs to me when I read that we are in a time when what is normal is very much up for discussion in terms of how people are experiencing the world, how people are reacting, who is in a position of authority to decide what is normal or not, what we call psychosis or not. Obviously, in America, that's a big topic of debate up to the highest office. What we might think of as reasonable or psychotic. And so it seems like it's an interesting time to reflect on terms like psychosis that we throw around quite casually. I'll just say I understand psychosis to describe a situation where people are speaking or acting in a way that they or others don't understand, and so there's fear. And that's the time we find ourselves in. But I'm offering this question from Sam. Who sets the guidelines of, quote, what is first episode? And I guess with him, I'm wondering if first episode is actually even a helpful term to use, if it seems to reify the idea that there's something that's normally human and some things that are not.
I don't know if it is bad that I respond, because I've already talked a lot. I'm very happy with this question, and there are almost tears in my eyes because I've made a journey in trying to understand what psychosis is, because I've suffered myself from psychosis, and I think it is not far away. It is something that can be present when fear strikes, and I've also struggled with how do I perceive other people's psychosis, and I've made a journey from framing it out of the model, the medical model, and now I'm more thinking in terms of that psychosis is more or less a language that we can't understand, and we need to listen very careful. And in my experience, there is always meaning in what is expressed in the psychosis. And so now I'm at the point that I think that psychosis is not a strange, abnormal thing, but in a very extreme way in dealing with an overwhelming stress, with the overwhelming sorrow, with the overwhelming narrative that can't be expressed otherwise. And so I'm now at the point that I think that mental health issues are not something that is for people that are separate, but are different. It is all down to being a human being, and there are different, I don't know the right English word, there are different dimensions or different, and that can change during your life, that can change with what happens. And I think one thing is, with psychosis, maybe psychosis can also be a very extreme form of traumatized, how do you call it in English? When stressed, you are too traumatized, that it is a way of, that your mind is, I can't find the word, I'm tired, but I will come back to that.
Thank you so much for those words and your thoughts on that, and your wonderful, beautiful way of expressing. When your expression brought tears to my eyes, and this conversation about first episode is a riddler for me, because having been around and gotten to hear a lot of case consultations or case presentations and read assessments and it will frequently say something like, I'm just going to really paraphrase this. I've never seen this actually written, but it might say something to the effect of, this person's really sick. They heard voices as a child. And it always strikes me as like, that's pretty much true for most of us. It's not so unusual. So, or I'm not saying that I can speak for all of humanity that's experienced this, but like the more people I talk to, the more this was just a part of things from a very early age, once we look back and really recognize it. Of course, as toddlers, as young as infants who may have been experiencing life a little differently perceptively, who has the language to articulate any of it? And then I think for so many of us, when we started to articulate these experiences and or visions that may have been a bit different, what was the message we got back, most of us, right? So I think with first episode, we focus so much on young adults or whatever the focus is, but like, I think it starts so much younger than that. And so I think it's just like not even it doesn't even make sense to me, this idea of first episode. My first episode may have been exiting the womb. I have no idea.
I just wanted to thank Leslie and Martijn for their really poignant thoughts about this matter. And Sam, I saw the question come up earlier in the chat function about this so-called term of first episode very early on in our conversation today. And and that question has been with me throughout our conversation so far. And at times it's been hard to focus on other things that we've been talking about because I've been thinking about that, and I've been really searching for some better words to sort of think about that. And I think that this concept that Regina mentioned about these islands of good practice made me think a little bit about how we're very much in a place in my setting where the rest of the mental health system, I think, is honestly trying to do the best that they can, but there's a lot of this language that is still around, and perhaps one thing that we were thinking was that we wanted to work with people who maybe didn't really have very much experience with the mental health system before, and then start working with people in this newer way to facilitate more dialogue and creativity. So I just I feel like I'm also on this panel to learn more from others here who have better language to use.
So, Rob, because you mentioned me, I would like to add something which is in my mind a chance how we can convince the system, because system are people on different levels, and in the system, in mainstream psychiatry, work professionals, and I don't know how many, but at least I know I met some of them who are really have chosen their job because they wanted to help the person. And as they realized that the system, mainstream system, is concentrated on symptoms and describing the diagnosis and describe the neuroleptics and then reduce the symptoms, and people see that it doesn't work. So these professionals, they are interested, they are looking for, they are even struggling for meaningful work. And as they listen about the new message, as they listened about open dialogue, either reading a book or an interview or a video, and they find most of them who are looking for something new, they found it what they looked for. So they found it open dialogue as concentrated on the person, as concentrated on the story of the person and the network, as a really taking this as a team, taking this responsibility and this uncertainty. And this is not easy, but they see results, sometimes very soon. And these results convince them to be even more engaged. So really, I see here in Poland that if there is a small group of people who would like to do something, and the group is growing, but we need to be proactive. We need to share this message. And then being in a bigger group and stronger group, then we knock the door of the decision makers. Then we require the money, because there is money, there are money in the system. So for me, it's really these people with heart, looking for people who would like their work to be meaningful. This is a chance for us to really make the system change. Yes, thank you.
I'll bring in two comments, one from Mark Hopfenbeck, who many of us know, asking, is mental health a term we should be using? It goes back to the beginning of our conversation. And Berta Britz mentions that the power to name needs to be relationally built, not imposed.
Mm-hmm.
And so what the question that calls to my mind is, how do we build a system in which we all share in the process of naming what it is we're trying to deal with, or what it is, how it is named? Yeah, obviously the system change involves shifting the power to name what it is that we're creating a system to respond to. So naming things is very important. Have you all experienced grappling with that in your efforts to change the systems?
I want to slip in like completely, probably more than likely unqualified idea. And that partly what I find so troubling about systems and systems change in regard to our services, and Russell spoke to it, and I think all of us can relate to it, is that the system has been created to hold psychiatrists or somebody responsible for the outcomes in terms of liability and clinical responsibility. And it is such an unfair and unreasonable thing to me in my way of thinking, that limits in almost every way possibility for change. And that is a significant thing that we should be talking about, that how does that make any sense when the system dictates and or blocks how psychiatrists and other clinicians can provide services, but yet will hold them responsible for outcomes that are not favorable, when it's truly the system that's imposing the unfavorable outcomes. Mic drop.
Yeah, I mean, I can only agree with you, Leslie. I mean, you know, it's not something. It goes, I guess, into the whole way the society perceives all of this, you know, and I guess as a society, we tend to feel better that we put someone on the spot, you know, and said, right, if this goes wrong, it's you carry the can. And it's not right on so many levels, right? It doesn't help anybody really. But it requires a lot of enlightenment, right, to be able to come out of that mindset. But you kind of put your finger on it there, right, on something really fundamental to what, you know, leads things to be the way they are. I mean, that's true. I mean, you're absolutely right. Yeah.
I want something to add, and that in a lot of talk about system and change, I hear less about the users themselves, about what can they do and what can they achieve, what can they bring to society and add to society. And so I think it is also a sort of radical change in the sense that we ourselves have to be part of the change and be part of the force that drives the change. I think that is really, really important. So I'm very glad with the adding of the P in POD, that the influence of peer support movements is, in my opinion, necessary if we want to have the real change.
Martijn, when you were talking about we have to be part of the change, and at first I thought you were talking about we, all of us here on this call, we, the human beings, and then I thought you were talking about the peers, and then I circled back to you're talking about we are all peers. We are all in this same dimension of reality that's full of uncertainty and suffering.
Yes, but I want to emphasize we as peers in a sense that it is easily, we have to have extra attention. We have to have extra attention for the people who are easily pushed to the margins of society and also to the margin of the change. So of course, and we are all human beings, and it is about dimensions in the change, we have to have extra attention to open up the space and keep inviting the people of concern to not only receive something, but also invite them to create a reciprocal relationship or reciprocal joining in the movement. Do you understand? Am I? Okay.
Your word reciprocal, we pronounce it reciprocal, both same word, but I'm feeling that word vibrating in me.
That resonates with Cindy Peterson. Dana's mentioned in the chat that in their program, 50% of the teams, 50% of facilitators and 50% of the teams in social network meetings are peers. And that's,
I always like to add as well that the Parachute Project, excuse me, folks, received a lot of attention, and I'm not sure it always receives the attention it deserves for being largely based on the idea of bringing peers into the provision of providing direct services. That I feel like sometimes that's an element of that project that is undervalued and under seen, if you will. That project, by nature and contract, opened up, I think, at least 100 peer specialist positions. And so I just want to always get that shout out that was a very important component of the Parachute Project as well, was the effort to bring peers into the direct delivery of services. And I just wanted to get that in there as well, that I obviously support that way of working and would like to see us continue to push for having more of us involved in providing services when it's appropriate.
What I find interesting is that peers were not a part of Open Dialogue in Tornio. And initially, I believe when Open Dialogue was, when people were looking to adapt or take the inspiration of Open Dialogue, there was a period of engaging with the question of how exactly peers would be involved in that process. And now that's come to the point where I think, by and large, it's a recognition that it's an essential part of the process. So how do we account for the difference? How do we account for the fact that there was, as far as I know, or nothing that we call a peer involvement in Tornio, although there may be actually one that wasn't called as such, I don't know. But how do we go from there to the fact that now we consider it essential?
Tornio.
I wouldn't dare answer that question, but I could speak to the fact that that change has always been dependent upon brave individuals that are willing to take the risk to step out of the norm. And in this case, I would suggest that Volkmar Adderhold has very much been one of the people who has stepped out on a limb and said that, yes, peers can do this work and they should be doing this work. And there is that history in Germany, which I think doesn't get acknowledged quite as often as it should, that they have been working that way for quite some time, as I understand it.
Yeah, and I think that a lot of what happened in Parachute was pioneering and helped the rest of us, really. Because as you say, it wasn't in the original Finland Tornio service. So I then managed to convince a lot of people in the UK about the importance of having peers within Open Dialogue, even though it's not in the original model, because of Parachute, and we were able to use that as an example that actually, and and demographically it's more similar to London, and so there's lots of parallels. So we were able to describe how it's a fundamental part of the model because they blazed that trail, and that's why our own work is very much peer supported Open Dialogue with peers in every team. But again, there's a big cultural pressure that we have to create to make that happen, because it's not in a lot of parts of the UK. It doesn't exist at all. Say in the Netherlands, you have great, there's some pockets of great tradition there. When I went to see your team, Martijn, and the center you set up is wonderful. We have nothing like that here. So a lot of energy had to be exerted to make that into a part of the way we practice Open Dialogue. But it was thanks to the precedent that we could show that existed in the States.
Rob Coates, Mark Hoppenbeck would like to hear more about your work in Atlanta and the inequalities and injustices that are the context for your work.
Yeah, thanks, Mark. I thought that was a great question. I saw it appear on the chat function and have been thinking a little bit about that. I think that in many ways, many of the people whom we work with have had their voice sort of silenced by many factors. I think by stigma, by the institution, by racism, by all sorts of sort of social and cultural factors. So when we began doing Open Dialogue and Open Dialogue inspired work in Atlanta, it was a real, I think it was a real paradigm shift, and really the goal was to really help to amplify people's voices in a way that they had otherwise been quite suppressed or maybe left behind. And I think that was a learning process for all of us, just in terms of amplifying that voice. So, and I was also just thinking a little bit about it too. I mean, I think that in some ways the work that we've been doing in Atlanta is different, but in some ways similar to the work that everybody else is doing. I think everyone, very many people who experience services in this way have been sort of pushed to the margins. So I certainly can't say that, you know, in Atlanta we're the only, you know, that's certainly not the case.
I really want to acknowledge what you say, what you've said, and it is interesting that I experienced during the open dialogue training and mentorship training and the open dialogue training I facilitate at the moment. I keep experiencing the difficulty people experience by bringing that marginalized voice. The voice not only about mental health issues, but also about culture, about inequalities. When I look at the services in Holland, the majority is a white, young, female or male, well educated. And I hope open dialogue and the system change will also bring in more cultures, more diversity, and also open up the space for those who are marginalized. That's my goal. Thank you for bringing that up.
For a moment, I looked to the chat discussion and I saw two words which I would like to refer, because we were, last minutes, we were talking about many times we said, or inspiration. We were inspired. So for me, this inspiration is between people. These people, if these people are in different countries, so then we say the inspiration comes from one country to another country. And it will be not possible if these people must have a courage or interest, must have leadership, as Barta said in the chat discussion, leadership. It really matters. So for me, I would like to take this opportunity to say that because we are from different countries and we have the same need, desire, dream even, that open dialogue will be spread not only via groups of people, but at least my desire is that open dialogue will be part of Polish system. So I would like to train many people in that. We would like to really open these who are right now closed, open their stories of people who have lived experience. This is the most important voice. So we in Poland as well invited peers to open dialogue trainings. And right now in this islands of good practices called community mental health centers, we have in each center peers employed, and we see that this is the best way to set up relationship to a person who is in crisis. Nobody has such power as peer support person, peer. In Poland we say recovery assistant. Recovery assistant has a really has an easiness to build relationship, and this makes open dialogue even stronger. So I would like to stress leadership, courage, recovery assistance, inspirations, and working together, being together as we are today. It's important that this is power of being internationally, meet through Zoom. So this COVID gave us new possibilities, I think.
I think that it's interesting, isn't it, Regina and others and all the listeners, that this global crisis that has sort of imposed so much isolation and staying away from one another has also created things like this town hall, where I wouldn't be otherwise in conversation with the other panelists or the people that are watching. And I think that that is a really powerful and important way for us to connect, that I would hope we can continue to do this sort of thing. I think it has opened up some of the boundaries that have existed between us. And I think that that's a good thing. And I appreciate you mentioning that there have been opportunities that have come from this. Thank you.
I will add even more, because a week ago we have started first open dialogue training on Zoom platform, and really the group is 16 people, and we all are amazed how it is possible, and it works. Of course, it's not 100% the same as meeting in the training room, but at least now, when the social distances is recommended, we have started the training. We soon will start the training for recovery assistance as well on Zoom. And there are open dialogue meetings already for last few weeks organized on Zoom. So really, we didn't imagine 2 months ago that we will do like that.
Likewise, with the team I supervise, I've been saying over and over again how neat it's been, how wonderful it's been to see the team so rapidly take on technology in ways that we had previously been uncomfortable with. Things like just Zoom conference phone calls or whatever, and seeing the team just really come together to help each other learn how to do these technical things has been amazing. And I think that it's going to be amazing to keep that going forward as well. So there has been a tremendous learning opportunity, because most of us have been like, that's not for us. We don't want to learn that. We don't want to do that. Now we're like Zoom monsters.
Yeah, that's right. We're all pretty much Zoom monsters now, I think. Yeah, it's true. And yeah, we have also been learning about new ways of doing things. So we're doing open dialogue network meetings on Zoom all the time now. And we're trying to work out, we've got a working group trying to understand how to facilitate network meetings broadly across our trial. We are doing it already, but we're all trying to share some learning around it, and things like actually potentially getting some technology, so maybe getting tablets to some people who are not able to connect that way, because there may be some relatives who can't join the network, but actually it enables often more relatives to join a network meeting, because they may be geographically from all around the world, but they can come together in a network meeting. So there's been some opportunities from this as well, and now also establishing a working group to think about how we can do that in the training as well, and deliver more of the training this way, because as you say, Regina, it's become a necessity, right? But at the same time, that's probably going to help us in some ways, because we've always been exercised about the idea that if our trial does come up with the results we hope it will, then how do we disseminate this, system-wide, countrywide in the UK, and that involves a lot of thinking about large-scale trainings, and we can't get everybody under the same roof. So how do we do that? And actually, we may be forced to answer some of those questions by working out remote means of training as well. So yeah, there's a lot of learning that I think we're benefiting from here as well.
There's been a discussion in the chat room about whether OD stands for Open Dialogue or Organizational Development, and I think that question bears further reflection. I think that a lot of the skills that come out of Open Dialogue are adaptable into, and are in fact, many of the people live in both worlds, in helping organizations understand their need for change, understand the members of the organization whose voices may not be sufficiently heard and may be causing stress. And as well, I think Open Dialogue has a role to play in the organizational development of our world in general. It's sort of an apt acronym to exist in for both terms.
Mm-hmm.
I submit for discussion.
It kind of reminds me also of a comment that Mark made before in terms of how Open Dialogue could have an impact on society, how Open Dialogue can help change society too. Yeah, I really think that's essential, because for me, the dialogical work in our service, in our system, in our healthcare system, is just one place to start, right? That's not the only place it belongs, but it's the one place we happen to be starting it. But it's actually necessary across the board. I mean, I think of the turmoil we're experiencing, certainly politically at the moment, is because we have a system that is no longer fit for purpose, right? I mean, centuries ago, we used to be governed by kings, and people were all right with that for a while. And then they realized, actually, you know what, who are they, to tell us what to do? And now we're governed by still a small cabal of politicians and others. Now we're realizing that doesn't make any sense anymore. We all have so much information and wisdom out there. And so really, we need a system that involves dialogue and joint decision-making, and us making decisions about our own lives, and not some remote person, sort of miles away and very removed from us. And same applies in organizations, right? I mean, a small board governing a massive organization, it doesn't make any sense, and it's never going to keep people happy. And so finding these ways to have dialogue at the center of governance, where everybody's participating, and there are experiments like this going on around the world, citizens' juries and citizens' assemblies and things like this happening. And I think that there's literally a need for that. I mean, we're going through a change in consciousness as a species, and what's happening now is probably accelerating that. And our current systems are not fit for purpose. We need to tear a lot of them down and change them in order for society, in order for our species to survive, really. And so I think open dialogue in the healthcare system is just one little part of that jigsaw puzzle. And maybe this is what leads the other bits to happen, but they all absolutely need to happen if we're going to stick around on this planet.
What comes to my mind as you speak is that we talk a lot about finding sort of the most effective or most efficient or most system to arrive at choices or decisions, or maybe the one that affords us the best, the greatest degree of certainty, whether it may or may not actually be the best. And I'm wondering if maybe open dialogue is instead a process that helps us to get to our best sense of what it means to be human, about what it means to live together, not exactly precisely the thing that we're trying to do as a result of that, but just a process that helps to continually renew our sense of what the best, what it means to be human in the best sense.
I think that is also something we can use to engage people outside mental health care or also inside mental health care in being part of this movement, emphasizing this and bringing them into the picture by going in dialogue with them and let them experience how their voice can be heard. So I have the tendency to open up dialogues on all places, in all kinds of contexts.
Very healthy tendency. Yeah. Mark Hoppenbeck has put in the chat, I don't know if everybody's seen it, but dialogical democracy as a new set of words together. I'm thinking about the network meetings in Open Dialogue as people have been speaking, how important it's been to cross the silos and to get the network around a family in crisis. And again, I'm just saying what we all know that are on this in this town hall is that we are a network. We're a global network, and I don't know how many countries. The first one of these town halls, I think we had 33 countries, people from 33 countries, and how I know Dan Mackler has said that his hour-long documentary about Open Dialogue has been seen by 1 million people, and in all over the world, and in the same way.
That was the last time we checked, which was a long time ago.
Yeah, true. But I'm just feeling this global network that we have that is creating its own local language and understanding and collaboration, and feeling hopeful about that and grateful to all of you who are on this call and are part of this community, democratic, dialogical democracy.
And Andrew Malfe mentions that he always thought that open dialogue works in the familial. And I think that's a very common understanding. I think to understand social networks in terms of the familial, but I think for a lot of people that's just where it happens to start in most cases. But so what's been all of your experience of trying to expand the understanding of open dialogue, but beyond just being a family approach?
So the first thing that comes to mind for me was thinking a little bit about the administrative response to the pandemic when everything started happening very quickly. There was, I think, a lot of fear, sadness, powerlessness, all the very major shifting of tectonic plates were occurring. And I was involved in a lot of meetings, and I was sort of struck by just how much, there was a lot of problem solving that happened, and it was about coming up with a plan, doing things, changing things all very quickly. And I think what this conversation has really made me think a lot about is how can we introduce more dialogue to administrative meetings? How can we facilitate this among the decision makers who are going to be supporting our systems? And sometimes there's a pretty big disconnect between the language that we use in these conversations and sometimes the language that the decision makers are thinking about, which to me really highlights the importance of the trial that Russell's working on and the data that we really need to help sort of expand these ideas more broadly. So I just really wanted to make, I think it's sort of it's an idea that brings dialogue beyond just the family and sort of expands it into administrative spaces and into and hopefully a call for more decision makers to think in this way.
I agree, and I want to add something. I find myself almost unable to explain in words what open dialogues is about to people who haven't experienced it. So research is important, stories are important, but I think we also have to add the experience of dialogue to the mix. And because it changes something inside, it changes, it opens up awareness, new self-awareness, awareness of this environment, about your own vulnerability. So maybe the national government can use an open dialogue session. I'd be willing to facilitate the open dialogue session, by the way.
I mean, I feel like the only way we can get it right or move towards getting things better is by doing that kind of thing, you know. And actually, I think a lot of time when people are talking about change in politics and society, they are talking about that without necessarily knowing it. I mean, and also we can't pretend that this is new either, and that this was invented in Tornio, right? I mean, this has been in human consciousness for thousands of years, right? We organized our societies this way a long time ago, and of course there's a big overlap with anarchy, and I don't always often use that word because you can't really influence policymakers when you say that, you know, they don't take it very seriously, but it is that, you know, it talks about actually people gathering together and making decisions for themselves, and I think you know, it was a very good question about whether or not this can be applicable outside a familial context, and I think it can for this reason. It's because rather than being related, it's about being emotional, right? It's about us actually connecting on the level of emotion with each other, and the truth is that when it comes to public policy, that is as important as it comes to our own familial relationships, right? I mean, we're all very emotional about these things, and so we should be able to share that with each other rather than just shout at the TV screen, which is pretty much all we can do right now, right? So having that ability to connect those emotions together creates a space within which enormous creativity can emerge, right? There's a new intelligence that comes about through people being present with each other's emotions. And that's why I guess it's about how you do those things. You know, it's about trying to facilitate them in a way that creates that space so that that intelligence can emerge between people. And I've worked with people, say mindfulness trainers and others who actually work in democratic forums trying to enable groups like this to happen. And I just feel like it's sort of waiting there for us to try to get to, if we can. Maybe we can't and we'll have extinguished ourselves before that point, but I hope we can, because I think that's kind of on many levels, you know, it will be what we will be easy with. Well, it's not going to solve all our problems. We'll always have problems. There'll always be difficulties and messiness in life and in human nature. But I think we can live that way, you know, more peacefully at least. But let's see if we can get there. I mean, we all need to talk about it. I'm always talking about that outside just the sort of healthcare work forum. You know, it's as important to me on that side as well.
I love that so much. I wrote that down so that intelligence can emerge.
I've sometimes thought that what we call psychosis is a result of a misguided effort to separate what we call intelligence or what we call intellectual from what we call emotional. And that actually, as soon as we can just accept that these things really don't exist separately, then we have a better understanding of what being human is and what being in dialogue is. And we can accept a wider range of emotions along with a wider range of ideas. And
We're golly, we've just got 5 more minutes, and I'd love to have you all have a chance, our dear panelists, to share a reflection about this time, if something arises about that you'd like to share.
I have one thing to add, and that is I feel it in my body now, and I feel also the sorrow that thinking about it brings to me. And that is I also mentioned in Wednesday, is the importance of being touched. I think dialogue is about words and about experience and about feeling connected, and this time made it very, very clear to me that we human beings, most of all, can experience comfort, but also stress by being touched. We need it even when when we not always can experience it through trauma, but sometimes a hand on an arm can say more than all the words in the world. And also, when you have no words left, that same hand on that arm can show the other that he is not alone. Thank you for this conversation.
In reflecting, I have been deeply touched and so cliche, but profoundly moved by this conversation, and do feel inspired and invigorated in a different way that I can't really articulate it. And it does have to do with tears in my eyes, and it does have to do with seeing people from far away, and it does have to do with acknowledging and recognizing that part of what has drawn me to this work has been the individuals that I have met and that have mentored and taught me. And it's the people in this community. And I feel like this today has been a reflection of that. And I just am profoundly grateful to all of the people on the panel and Kermit and Louisa and everybody listening, that it is the community that holds this together and is going to keep pushing it for more change. And I'm happy to be a part of it.
I would like to take the opportunity to add to your list, Leslie, Rafaela, Pocabella, and the HOPEnDialogue project, and Open Excellence, the Foundation for Excellence in Mental Health Care, our partners, and the Open Society Foundation that has provided some of the support that has made this possible. And now I return to the other panelists for final reflections and wrap up.
Yeah, you mentioned the word project, and I would like to really thank you for inviting me. I feel honored to be with you today and have possibility to listen to you, share what we are doing in Poland. And I would be really I would suggest to have possibility not only to meet each other, but under the town hall or met in America, have the possibility to access for some project results, description, some information which we might share in Poland. So it would be really good to have this as well, place of gathering these facts, this project outcomes. So really thank you, and yeah, for sure we will meet because of Zoom quicker than only once a year. Thank you.
Yeah, and you're right. This is about community, and I want to thank you, especially Kermit and Louisa, for holding this community, bringing it up like this, and creating such a large and warm space. It's not an easy thing to do. I can't imagine how much you. I have a slight hint of just how much is involved for you guys doing this. So, thank you so much for doing this and for bringing us together in this way. And also thank you for your words there, Martijn, about touch and the importance of being together physically. And I can't claim to be a huge royalist or anything, but the Queen in England made a statement to the nation at the beginning of this crisis that actually very much touched me. I'm not used to that, being touched by the Queen. But the last words in her statement were, "We will meet again." She spoke with conviction of somebody who'd been through the war, and she talked about her experience in the war, and then how they came together after that. And I really feel that. I really crave for the time when we will meet again together. Yeah.
I just wanted to add one thing. I think that sometimes doing this work can really be kind of against the grain, and there can be a lot of challenges, and we're in an especially challenging time right now with what's going on. And just to what everybody said, I think it's this community that's really going to get us together and get us through this. And even just on a smaller level, I feel incredibly supported by the people on the panel, and really I'm deeply appreciative to them, as well as Kermit and Louisa for hosting this. It's always such they have an incredible way of creating these very warm spaces in things that can otherwise be fairly anxiety provoking, like talking in front of a lot of people. So I really appreciate that.
I'd like to wrap up with some words that were offered very early on in the panel. I don't remember who put them there, but they were originally spoken by Socrates. The secret of change is to focus all of our energy, not on fighting the old, but on building the new.
Mm.
And I feel that right now. I feel that.
Mm. Yeah, there's definitely a very fascinating thing that happens in these meetings where we get attached to each other. It's like I'm thinking, oh no, we're going to have to say goodbye to everyone. But as Russell says, and Regina said, we will meet again. And I trust that we will. And I think we're having...
in fact, I'll send a Zoom invite to everybody on the panel. If you're available to stick around for a few minutes, we'll just...
Bring the turkey, Sam said. Yeah, Kermit thought of having the turkey on his shoulder through this gathering, but we decided against it. There is something, oh yes, would you talk about the June 5th town hall just briefly?
June 5th, we'll have a town hall of hearing voices, people representing the Hearing Voices Network, and hopefully also somebody who can bridge the two, who has done training and who has participated in both worlds of hearing voices and open dialogue to explore that connection. But it's principally focused on all the efforts that have been going into making bringing the hearing voices ethos to the online world.
Yeah. So with reluctance, we say goodbye to you, dear attendees, and we'll look forward to whoever can come back on June 5th. And thank you so much for coming on with us.
Thank you all.
Bye.